Hi, welcome back to Future Fast. And once again, we have Professor Brian Kennedy with us. And for those of you who are here for the first time, I know many of you come only to listen to the future conversation and predictions. I sincerely urge you, please look up the first two parts of the conversation with Professor Brian, where he shares the journey. And second part, he talks about all that. Not exactly what he's working on, but clearly what are the challenges and opportunities and the way things are happening. So, very interesting conversation. I'm sure you will appreciate it. And with that, once again, Professor Brian, thank you so much for making time to be here with us and welcome once again to Future Path.
Happy to be here.
So, jumping right in, so please share your perspective on future. What kind of a future do you see?
Well, I think that the exciting thing about the future, from my perspective, is that we may be able to really avert these chronic diseases that are afflicting so many people in the population. Aging is the biggest risk factor for almost everything. It's the biggest risk factor for all kinds of chronic diseases, for cancer, for dying from COVID-19, as we discussed earlier. It's the biggest risk factor for getting hit by a bus or breaking your hip. And you name it, it leads to a lot of diseases. It also leads to functional decline. We don't do things as well when we're in our 50s, like I am right now. We don't do things as quickly and as well necessarily as we did when we're younger. I mean, our body's very good at compensating, but there's certainly things I can't do now that I used to. The ability to like slow down that process and to prevent all of these diseases simultaneously is really a revolution in medicine. And if we can achieve that, people can look forward to being healthy in their 50s and 60s and maybe 70s and 80s, and who knows what's possible in the future.
And are there things that scare you as well from the future?
Are there things, sorry.
Things that scare you from the future? What scares you
Yeah.
most about the future?
I'm not one of these people that get scared of things. I'm a bad person to ask that question. Um, there's a particular presidential candidate in the US right now that scares me.
Okay. So your fear is fairly short term. So that's okay. So you
Well,
at best you'll have to endure it for 4 years, but not more than that.
I mean, elaborating on that a little bit, I do think we have a global leadership crisis right now. So many countries have, you know, sort of retro thinking political leaders that are more nationalist than they are globalist. And I've been fortunate to travel all over the world and been to many, many countries. And the one thing I've learned is that they're very interesting people that are educated and valuable everywhere. And the more we can cooperate together, I think the happier we're all going to be. And right now, it seems like the world is heading in a more nationalist oriented directions. And that kind of scares me a little bit. But hopefully, that's a temporary issue and we'll get back on track.
I think so too, because even both the First and Second World War actually lasted only for 4.5 years at best. Of
Yeah,
course, the
let's hope it
impact
doesn't
lasted
get
longer,
that
but
extreme.
yeah, the
Yeah.
outcomes were far more extreme, but the whole timelines were actually 4 years. So typically like a presidential term. So
Well, things change so fast, and it's easy. In the U.S., the we have Trump who's really likes to blame everything on immigrants, which I find statements like that just to be so damaging, regardless of his other policies, because the U.S. is a land of immigrants. Immigrants is what made the US what it is. And, if you go to Silicon Valley where all the innovation is, you see people of every color when you go to investor meetings and from every part of the world. And that is what made the US a leader. And whenever something hurts a segment of the US population to blame things on immigrants or foreign countries, I feel like that if you want to be you know, exceptional. You're not exceptional by criticizing other countries. You're exceptional by acting exceptionally. And I feel like the US has kind of lost that thread recently, and it when the US misbehaves, it trickles down to lots of other countries as well. Maybe unfortunately, but that's how it is. So it just it seems that's what worries me these days, not medical technology advancements.
So, who are the which are the countries you think in future which will be doing exceptionally well? I mean, if you considering, if you think, or you will still think US will still be doing exceptionally well, but who else along with US?
Well, I think being here in Singapore, you have to, give a shout out to Singapore. I mean, this is a country in 1965 that was, had a lot of challenges, and it's really sort of pulled itself up. It had some advantages. It's a small country. It has a huge port that everybody has to use, but a lot of countries have advantages. Singapore took advantage of those and really developed itself into a, world leading economy. It's small, but it's the quality of life here is very good. The healthcare is very good, and so there are examples like that. I think I'm encouraged when I travel to India, to China. I think there's a lot of technology advancement going on. There's more research, and so I try to see a lot of, or I don't have to try. I see a lot of positives in how things are changing in countries like that too. So there's a lot of good leadership too. It's just that it seems like the world powers right now are struggling at the moment.
Uh, I was talking to one more gentleman in one of the conversations, and he also struggled to find something good about Europe. Why is it that people don't find something good about Europe as quickly as it was in the past?
Yeah, I think Northern Europe, a lot of countries there have very good policies. They're also doing a lot of longevity research in Germany, Denmark, and so I think there's a lot to be taken from there. I think that what I'm worried about with Europe is that it continues to fragment. I think that Brexit was a strange strategy for Great Britain, but it we don't want that to continue and to continue to fragment the EU, which I think overall has been good for Europeans, and so and also good for research. There's a lot of EU funded biomedical research that has really, we talked about collaboration. A lot of those grants go for different labs around Europe to collaborate with each other, and it's really moved science forward. So, again, I call me a globalist if you want, but I like to see that sort of cooperation, and I think everybody's a lot more secure and can move forward from a scientific perspective a lot faster as well.
Wonderful. So, Professor Brian, can you make some predictions? We always get our guests to make some predictions. So,
Yeah, I think that the longevity field, first of all, will validate that there are interventions that you can probably the first things will be in the forms of pills you can take that slow aging and they keep people healthy longer. Maybe 5 years of health span. It doesn't sound like a lot, but that's already a bigger.
just to get again the context. So, you say we will have pills which we pop in, and it will extend our healthy life by 5 years. That's what you're saying?
5 and 10, maybe. I think that's reasonable.
Okay.
I don't think
And
anybody knows.
by what point of time do you see that happening?
I think the hope is that we can validate that these things work in a 5 year window and maybe get relatively widespread use of them within 10 years. And some of them are natural products. And see, the challenge right now is there are many, many candidates, and we don't know which ones work in humans. But we're learning how to do those studies, and I think we'll be able to validate that. And if they're natural products, they're already available on the market, so they may go into widespread use. Or repurposing drugs are another possibility. So I think that's going to happen. I think the more fascinating question, though, is can we reverse aging? Is or can we stop aging? And I think that there's not very good data that that can be done right now, but there is some hints that it might be possible. So that's something for the future. But will we really have people living to 150 or 200, or going from 50 back to 40? I think those are really exciting scientific questions, and I'm looking forward to the research in the next couple decades that tries to answer them. And the answer may be no. I don't know. We'll see.
So, from your point of view, what is the longest and healthiest long life a human could achieve in our timeline, as you see it today?
So that right now the longest lifespans are around 120. Um, Most people that live to be 100, they also have a long health span. We tend to say those are two different things, but they go together. I mean, you don't get to 110 unless you're pretty healthy, and so the centenarians and the super centenarians who reach 110, they tend to have a very long health span. Those people are probably, it's happening because of genetics. Usually, for the majority of the population, the aging is probably driven more environmentally and lifestyle than it is genetics, maybe 70-30. But for these centenarians, they happen to have the right combination of genes and they live a long time. So I think when we look at the interventions for the population, what we're going to find is that people stay healthy longer. What we don't know is whether their maximum lifespan is going to go up or not. It may square the curve so that more people get to that maximum lifespan and they stay healthy longer, which is good, by the way, if that happens, that's okay. Or it may extend maximum lifespan. And I think that it's unclear what's going to happen. Now, in the animal models, we can generally extend maximum lifespan too. Mice, we can probably get 40 or 50% increase in maximum lifespan right now, which would be a lot in humans, but there's not any evidence whether that will or won't happen in humans yet.
Uh, so, do you think most of us, with the popping of the pill, which will come about in next 5-10 years, will get to be about 100 to 120, majority of the world population?
Well, there's a lot of embedded questions there. I mean, anytime you have a medical technology that advances, how fast you get it from people that have access and resources to people that don't is a major challenge. I mean, you can look at that with HIV therapy. Um, my goal is to democratize everything we do and make it available to everyone. But there'll be a period of time, for that to happen, even if the interventions are cheap. And so, how fast it gets taken up by people is something that's hard to say right now because we don't know exactly what interventions are going to work. Um, I don't think it'll be uncommon to have centenarians around. It's already becoming relatively common, and I think it'll be much more common in the near future. I think you'll start to see, people that are older still performing at a very high level. I mean, you'll may see, golfers winning golf tournaments in their 50s in the made in the young person's tour, and so those kinds of things may happen. Um, and so, I think that it's going to be exciting, and the challenge right now is to validate and still do the science and find the best interventions. But it's rapidly going to change to the challenges that you already face with lifestyle now. I mean, if we can take a step back, if you choose a really healthy lifestyle, you'll already make your health span go up. If you're exercising, if you're sleeping well, if you're managing your stress and you're eating the right diet, you're going to live healthy longer and probably live longer as well. But not that many people choose to do that. And so that is kind of an implementation science problem now. It's like, how do you induce the masses of people in a country to move toward a sustainable, healthy lifestyle? And so I think what'll happen is that once we validate things that work with pills, then they're going to move to that step too. How do you implement it? How do you get it into the whole community? How do you get it into poor countries as well as rich countries? And those become different kinds of challenges.
So, the pill could be more effective for those who have a sedentary lifestyle rather than a very active lifestyle,
We
so
don't
that
we
it
don't
it makes good for their not being so active and having a healthy lifestyle? I mean,
We don't know. We haven't done enough testing yet. I can say that there's a product that actually I'm involved with, the company, so full disclosure. The product is called Rejuvent, and it has alpha-ketoglutarate, which is a natural product, and then a vitamin in it, a different vitamin depending on if you're a man or a woman. And so we've done some clinical testing with this. And in that case, we can measure people's age with these biologic aging clocks now. And when we do that at baseline and then take people that are taking the product for 7 months and do it again, it reverses their biologic age by about 6 or 7 years. Now,
that
that was
is
not a
not with a very active lifestyle or workout.
well, I'll come to that in a second. So let me first say the caveat is that this is not a placebo-controlled study. This was just users of the product. So it's not the kind of clinical trial that you really want to do. And we're trying to go back and do that now. But with that data, the people that responded to the best were the people that were biologically older to start with. So the people that were not aging well responded better than the people that were already really young. But we don't know if that's going to happen with every intervention. There may be some longevity interventions that work better if you're exercising all the time. There may be some things that work in middle age, but not late. There may be things that work better late. And all of these questions are unanswered because there's so few clinical studies in humans right now that I can't, point to any consistent trends.
So that's why you're safely putting it at 5 years away before.
I think it's a reasonable hope. And it may not be that product. I like that product, but there are lots of others out there too. We need to test them agnostically and try to find the best ones. And by the way, nothing is going to work in everybody. We know that already from medicine, right? So we have to figure out which people respond to which interventions, and that's going to be another
And
challenge that we
also the distributed population across, right? The genetics of people across India,
yeah.
Asia itself, to
Well,
Europe,
we
US.
just completed the study. We haven't published yet, so I can tell you the gist of it. We looked at 10,000 Singaporeans and did biologic aging clocks with DNA methylation, tried to measure how they're aging. And those clocks were built in Caucasian populations or US populations. There may have been a few Asians, but it was mostly Caucasian and African American and some Hispanic. And when we had tried to apply those clocks to Singapore, which is, Chinese, Han, Indian, and Malaya ethnicity, they worked, but they didn't work perfectly. And so what that means is we need to build clocks that are specific to each ethnicity and maybe regionally as well. And so you're right. And how we measure aging is gone through is just a revolution of science
And
in the
perhaps
last
even the
decade.
food habits matter. I mean, a lot of
Food
factors come in.
habits, yeah, all of these things are going to influence aging. So we're still learning how to measure biologic age accurate, accurately, but it's probably going to have to be tailored to specific groups of people.
Wonderful. Well, Professor Brian Kennedy, thank you so much. And one curiosity question: your second name, is it anyway connected to the famous Kennedy family?
Not directly, no. I mean, I do. My father's lineage comes from Ireland. I'm sure if we go back,
So it
several
does somewhere.
hundred, but I'm not benefiting financially from the current Kennedy plan.
Okay, right. But I'm sure this is a question you must have got a whole lot. So,
Yeah,
right. Wonderful.
yeah.
Thank you so much. And once again, to all the audience and listeners, all the links to follow Professor Brian Kennedy is given below this podcast itself. And to follow the activities and also the links to those videos that he's been producing, and over 100 videos he mentioned in the first thing. So all of the links are there. So uh, follow it and follow his work as well through the link that's shared below it. And till we meet again, enjoy the ride. Once again, thank you so much for doing this.
Thanks. It was fun.